Well, many people use calcium supplements to build stronger bones, but a new report linking supplements to a higher risk of heart disease may give some women pause. News 4's Dr. Peter Ostro takes a closer look.
After menopause, women begin to lose calcium from their bones, and that makes them vulnerable to fractures. Millions of women take calcium supplements and other medications to try to prevent that.
It's been successful. The number of fractures has gone down.
Dr. Graham is a cardiologist. She recently saw a report in the British Medical Journal that reanalyzed data from the Women's Health Initiative and concluded that calcium supplements modestly increase a woman's risk of cardiovascular disease. But she doesn't agree with the way the information has been analyzed.
The paper's not very good. As a scientific paper, it raises questions, and that's good always to raise questions and ask us to examine our practices. But it's not very good science.
She points out that the majority of women had been taking calcium before the study began and that they had no adverse effects from it. And an editorial that accompanied the article agreed with that, saying it's not possible to link calcium supplements with heart disease risk. It's also important to know that increasing dietary calcium is beneficial, not harmful. Most of us don't get enough calcium in our diet, especially when we're young. And for those who have decreased bone density, supplements help.
Women who have osteoporosis, who are seeing a physician or are taking medication for a specific disease, should continue to do that.
Now, if your bones are normal, you don't need calcium supplements. You can maintain bone density by eating foods that contain calcium and by staying active. Exercise, especially weight-bearing exercise, really helps strengthen your bones as well as your muscles.
But the concern here is for women after menopause who lose bone density. What about that?
Well, you know, the stronger the bones are before menopause, the longer they'll stay healthy. And we build our bones as kids and adolescents, and so that's the time when a high-calcium diet is really important. And interestingly enough, soda pop contains phosphorus, which removes calcium from bones. So drinking soda instead of milk as a kid sets you up for osteoporosis.
So that's a good warning, I think, for parents now who have daughters and, you know.
Right. Something for us to regret.
Yeah, I was going to say, it's too late. It's too late. All right. Thank you so much, Doc.